Okay, so here I am with my third patient, and once that I'm in the room and I identify myself, I wash my hands, I take some precautions, and I verify the need I'm there for the patient. We're gonna keep taking the blood pressure as mentioned before, heart rate and respiration rate. So first, what we're gonna do is we're gonna locate the brachial pulse, as we mentioned before. We're going to do it with these two fingers. So let's try to locate the pulse first. You can put it down. It's fine. Relax your arm. The patient has to be right seated with the uncrossed legs, and the arm should be resting at the heart level. So once that you find the pulse, we can go ahead and start putting the cuff and following the directions. Like that. Always we're gonna go 30 above, as we mentioned before. Okay, perfect. Okay, so this patient has exactly 120 over 80, which is a borderline pressure, so below that range. We said that is optimal blood pressure. That sounds perfect. We can go ahead and record that in our records. Um, and then we can keep going for the heart rate and respiration rate. Remember always that respiration rate is 12 to 20 breaths per minute. Heart rate should be 60 to 100. And for that, we want to have, once that we have more practice, like we mentioned in previous videos, we want to have while we're counting for 30 seconds, the breakup pulse, I mean the rate of pulse, we can go ahead and start looking for the chest expansion of the patient while we're doing the respiration rate as well. So we can go and set up our phones for that to help us out for 30 seconds or for a minute. So we should confirm it in case that we have any abnormality results or anything that we see if the patient use any accessory muscles or something like that. So what we're gonna start counting, okay? So 1, 2, 1, 2, 3. So once that we count, always remember if we count for 30 seconds, we have to multiply that by 2, and that will give us the accurate result for like a full minute. In case that we have any abnormality that I mentioned before, we will have to count for 1 full minute. So now we will do the same by looking for this chest expansion and you looking for the respiration of the patient. Remember that once that we have more practice, we can do that as we counting towards the respiration rate as well, and we can do the two tasks at the same time. But for now, we're going to do it like a separate way. So we're going to count and we're going to set up our phones for 30 seconds as well and look for the chest expansion and to see if the patient uses any accessory muscles or anything like that and count for the respiration rate. So that will give us the breaths per minute, okay? Perfect. So once that we have it done and we record the records, we can go ahead and type it in on the results. Thank you very much for watching.